My name is Dr. Eric Nelson with Nirvana Health, and I'm here to talk to you about regenerative medicine and specifically prolotherapy. So, prolotherapy is one of the most commonly used regenerative injection therapies. It's essentially a dextrose, which is a glucose or a sugar solution, which is naturally occurring, mixed with an anesthetic, which will help numb the tissue. Essentially, it's injected into any area that did not heal well the first time. Okay. And so, typically speaking, it's a stimulus to the body for the immune system and the local stem cells in that area that was injured to say, hey, there's an injury here. We didn't heal it well the first time. Let's give it another try. And so basically, you're using a really, really safe irritant solution, which in this case is dextrose, to stimulate the body's own natural healing mechanisms to come in and do the work. Prolotherapy is really, really commonly used in tendon issues. So anybody that has, you can think of things like rotator cuff or golfer's elbow or tennis elbow or jumper's knee or IT band syndrome, as well as arthritis is the other big category. So anybody that's had osteoarthritis, even even other types of arthritis, some autoimmune types of arthritis as well, can benefit from prolotherapy. So prolotherapy is one of the only ways to basically restart a healing mechanism. So typically, I see patients that may come in and they had an injury 2 years ago, or 3 months ago, or 6 months ago, or 10 years ago, and they have had pain or discomfort or a lack of function ever since. And what that tells me is that their body healed it, the body thought it healed it well enough, and then it stopped. It stopped responding to that injury, and it hasn't really gone back in to change the mechanics at all. So prolotherapy is really one of the only, I guess you could say, regenerative medicine, including prolotherapy, is really one of the only tools that we have to go back and poke at the body and say, hey, go right here. This ligament specifically, this tendon, this joint never healed right the first place. So we need to redo it. So it's a hyperosmotic solution, which essentially stimulates local immune cells in the area to respond as if there's an inflammatory reaction. So immune cells will come in, they'll eat up old scar tissue, old fibrotic tissue that's really not laid down in a proper way, really not three-dimensionally functional. And those immune cells will pull out some of that old tissue, and then local stem cells, local tissue that's healthy is stimulated to proliferate. So that's where prolotherapy comes from. It's a proliferative therapy, and you're trying to proliferate the healthy tissue and get rid of some of that unhealthy tissue. So realistically, the reason why it falls under the umbrella of regenerative medicine is because it's a stimulus to boost or bump up the regenerative processes in the body and to slow down or to dampen the degenerative processes in the body, which creates this nice favorable healing cascade, which just basically pushes your body into laying down new healthy regenerative tissue and then trying to limit the loss of or limit some of that degenerative process that's naturally occurring as we age. Head to toe. Head to toe. I love saying that. You can basically treat any ligament, tendon, joint that you can think of. There's ways to do it safely. Just like any injection, it can be a little bit painful. Usually, just poking the needle through the skin typically is the most discomfort that my patients will experience. There's a little bit of a fluid pressure that also takes place when you're pushing the fluid in, but typically speaking, the discomfort is minimal with the exception of a couple areas of the body that are very sensitive, like the bottom of your foot, for example. There is a little bit of soreness, discomfort that you can expect for 1 to 3 days after the injection. And that's because you're trying to stimulate an immune response, which involves inflammation, right? So you will feel, or you should feel, a little bit sore after that injection. That's completely par for the course. Great question. And the answer is it's individual, right? So you can't, it's really hard to predict. In my experience, 2 to 4 injections is the average. Okay. Some people, the really young, healthy individuals, will respond quicker. So they sometimes can get away with just a single injection, maybe 2 injections. Some of my older patients, some of the patients that don't have, they may have other diseases that will impair their ability to heal, such as my diabetic patients or my obese patients. They typically need a couple more. So I'm thinking on the edge of 4, maybe a little bit more than that. Great question. That's probably the most common alternative to cortisone. So cortisone is a steroid injection, and it's very, very common in medicine. Typically, it's like a blunt tool that will just calm the immune system down. It'll basically shut off everything. So if you inject it into an inflamed, swollen joint, cortisone will usually calm down that inflammation, calm down all those signals that are being sent to your brain saying, hey, this is painful, don't walk on it, for example. So the downside to the cortisone is that it blocks the normal healing mechanism, right? So long term, what is that doing for you? If you feel really good, but the joint itself is still injured, and you go run on it or you go do any activity on it, you might be doing more damage than you would have if you didn't get any injection in the first place, right? So you can get a little bit in trouble with cortisone injections, and I think that over time, cortisone injections tend to actually increase the amount of degeneration that occurs. The exact opposite is true with prolotherapy. Prolotherapy is a regenerative injection. It's a regenerative procedure, and it's working with the body. It's not trying to calm the body down. It's not trying to completely blunt the body's response. It's responding with the body and telling it, hey, we didn't do this right the first time. Come back in, do your thing. When you're ready to go back to work, we can go back to work. And you can feel safe going back to activity. And so almost all of my patients with prolotherapy, they're getting some very specific progressive exercise regimen, just like physiotherapy. And the reason being is twofold. One is it makes sure that your new tissue is being lined up in a three-dimensionally intelligent way. Right? It's a functional tissue. And two is you can work with your body to get back to activity stronger than you were before you had the injury, right? Or at least as strong so that you're not thinking about that injury. You're not avoiding putting all of your weight on that side, right? You're not trying subconsciously or consciously to get around the pain signals, right? If you work through it properly and intelligently, you should be able to get back to your activity at or better than you were before. So platelet-rich plasma, which is PRP therapy, is where you take blood out of somebody's vein, you spin it down, and you take the little portion right in the middle where all the platelets are, you take that and you concentrate it and put it into somebody's injured tissue. And PRP is a little bit more invasive than prolotherapy. It's actually quite a strong signal for healing, but it requires one, that your blood is actually healthy, right? I guess that would be true for both of them. But for PRP, your platelets and your tissue is the medicine, right? So if you are struggling, if you don't have a very good healing response, those platelets are not going to be doing what we think they're going to be doing or what we want them to do, right? Prolotherapy doesn't rely on your platelets as much, right? Yes, it will stimulate platelets in the area, but typically prolotherapy is just dextrose, anesthetic, some B vitamins that are injected into an area. It's going to have a similar response in everybody. Well, I'm a huge fan of anybody that does prolotherapy. I'm a huge fan of any doctor that's been trained in regenerative medicine and they're using any of these techniques. So perineural, prolotherapy, PRP therapy, stem cell therapy. If your doctor is doing that, they're confident, they've been trained in it, absolutely go ahead. Naturopath, this just fits into our model of how we want the body to work. We're always working with the body. We're not trying to work against the body. We're utilizing a holistic view of your health. So we're not just going to give you a shot in the knee and tell you to go home. Right? There's a little bit more to it. And I think that regenerative procedures really fit the bill as a naturopathic therapeutic, right? Or modality. Torn rotator cuffs, I would say, with the exception of a fully torn rotator cuff, which requires surgery to, put one piece back onto the other piece. All of the partially torn rotator cuff injuries or the tendinitis or the tendinopathies or the tendinosis, all of those actually respond really well to prolotherapy in my experience. I would say that prolotherapy or perineural therapy are two of my most utilized therapeutics for people that have chronic migraines related, especially those that are related to tension or upper cervical instability. So a lot of people will have tension either consciously or subconsciously. A lot of it has to do with your posture, your state of stress, maybe your work or your occupational hazards, and that tension can build up and start to irritate some of the nerves that are coming out at the base of the skull that come around to the front of the head and can cause these frontal types of migraines or headaches, chronic headaches. So that's very much the goal. I think that prolotherapy in the case of arthritis is a great example of this. So arthritis, there are a few treatments in conventional care. Cortisone injections, like we talked about before, and then surgery eventually. So once the arthritis gets really bad, they typically will recommend a total replacement, a joint replacement, or a total knee arthroplasty, for example. And those replacements have a pretty good history and a pretty good prognosis to them. They actually do quite well in reducing your pain and your dysfunction and your disability. However, there's a time limit to how long they're effective for. And that's simply because it's hardware. You're putting hardware into somebody's body, and eventually that hardware will break down, right? And so in a really good scenario, you have that hardware in your body for 15, maybe 20 years before it starts to break down, it starts to get loose, and you need what's called a revision surgery. And revision surgeries are not fun. They don't typically go as well as the first surgery, and typically the patients are quite a bit older than they were on the first surgery, right? So they're not capable of handling as much stress as the original surgery. That's where we come in. That's where regenerative medicine comes in. Because if you can delay or postpone getting that first surgery till the point where they're going to live the rest of their life with that original hardware and they never have to get a revision, you've now put them into a way better place. I'm not deluding anybody. I'm not telling them that they're going to completely avoid surgery, although that is possible. At least we're trying to postpone it. We're trying to push it back as far as possible so that you get the best outcome. You can maintain your active quality of life for as long as you possibly can. There's not a lot you have to do, actually. The one thing I'd ask is that they stop taking strong anti-inflammatory medications right before, typically about a week before your procedure. And that's just because those anti-inflammatories are going to interfere with the inflammatory reaction that is the initial stage of prolotherapy's healing. Prolotherapy procedure is relatively straightforward. We typically, after going through all of the pros and cons and what you can expect and how you're going to progress after getting the injection and you're on board, you essentially just get the patient seated, lying down, or on their back, depending on the type of procedure. And then we clean the area. We go through maybe I would say on average between 2 and 10 pokes, and the injections are probably going to last about 10 minutes in total duration. So clean the area, maybe some sort of a topical to reduce your irritation, and then we just go through the injections, and then we make sure that all of those little needle pokes have stopped bleeding, and you go home. The results are going to be very independent to you. So that's going to depend on your health status. The healthier, more vibrant you are, and the better healer you are in general, the better you're going to respond, the faster you're going to respond, the easier it's going to be for you to go back to your activities. Typically speaking, you're going to have 2 to 3 days of a little bit of soreness, a little bit of discomfort. I usually tell my patients, take it very easy for 2 to 3 days. I don't want you to hurt yourself. I don't want you to cause any issues. Then you're going to go through about 2 weeks where you're feeling better, better, and better, and better, and better, and better. And basically what we're looking for is whether you continually get better, in which case that's it. You only need to continue with your physiotherapy exercises and your other recommendations. You don't necessarily need to get injected again. Some people, though, they're going to get that injection. They're going to feel better, 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 better. Then they're going to plateau. And if they plateau, that's when you do a second procedure. You do a second injection so that you can continue going on that upstream.